All right, we're good to go.
Great, thank you. Good afternoon, everyone. This is the Mental Health and Addictions Task Force. It's October 26th, 2022. It's 1 p.m. Call the meeting to order. Are there any declarations of interest? Seeing none, if one should arise, we can deal with it at that time. Item number 3, delegations from Naomi Bodden, Director of Mental Health and Addiction Services, Grey Bruce Health Services. Naomi, good afternoon. You have the floor.
Thank you. Thank you for the invitation. And I'll let the slideshow come up. Thank you, Sarah. So just a little bit of an update. As I believe I've spoken to before, we have now received funding for our Mental Health and Addictions Wellness Center. And you'll notice it has no name, but it is what we formerly called the Bayview Wellness Center. We did want to leave it open in case there were fundraising opportunities, community groups. So we thought, you know what, the Bayview was a placeholder because it was at Bayview School, but at this point, we're just going to call it the Addictions and Mental Health Wellness Center. My team always goes back and forth. Is it mental health first or addictions? But for this program, we're saying it's the Addictions and Mental Health Wellness Center. And I didn't catch that. So, well, can you move to the next slide? So we have begun to work on the building. The interior walls have been largely demolished, and work has been going on IT cabling. The electrical had been pulled out at some point. There had been a lot of vandalism in the building. So and there was a lot of vandalism on the outside of the building. So they started to paint so that we could cover some of that. And so it's really kind of underway. It's very exciting, and we are slated to be done by June to September. We're kind of floating between those dates, so I guess I'm saying September to be safe. So we're going to have acute detox services, outpatient services, and 17 longer stay residential housing units. And we have some beautiful grounds. It's a beautiful location. I think most of you may know the location, and lots of trees and quite beautiful. So in time, we hope to capitalize on the land and develop further gardens. We have a very large community room built into the design, and that will allow for a lot of opportunity for community presentations. We are in the process of hiring a designer to choose colors that are calming and reflect the beautiful nature of both our counties. And so we're well underway with camera design, and it's meetings every week, a couple of meetings every week on all the design elements. So next slide. So we've started to engage with our community. We sent out letters to the neighbors in the vicinity. So we had 2 batches, one very close around the building, and then a further group. So we've invited them to reach out. We have an email address and a website that launches off our GBHS website, so people can ask us questions or express concerns. So we have met with community members already. And as a result of that conversation, we're really looking at adding fencing along the property line and putting some more shrubs and trees around the 6th Street access where there's some houses there. I guess it's the 7th Avenue. It's that side access. So we're looking at doing some work there. And we're also working to reopen the 6th Street exit. Entrance exit, so that we're not going through the neighborhood. And so that, really overall some good meetings with our neighbors, and I hope that those little changes will make them feel much more secure and safe. We do have staff, security 24/7. So, and cameras and lights built into, that's what we're working on, the design where the camera goes, to make sure that we have coverage all around the building. We are also looking at removing the catwalks that some of you may be familiar with, just so that we control entrance and exit to the main lit entrance. And so for those of you who've maybe walked your dog in the neighborhood, there is some, I'm pointing with my mouse, but that doesn't really help you. There is there is a few alternate routes to the building. So we are looking at shutting them down, which is unfortunate in one way, but we do think it will provide better security for both the building and for our neighbors if we do that. And I also do want to flag, just in terms of our services, that in right now we operate a smaller, but a withdrawal management just up by the Grey County building. And since I've been director, I have not had any issues with people sleeping outside the building, being involved in the building, and certainly Kim and the rest of Grey County could probably weigh in on that. It's
no, as neighbors, they certainly have never had a negative impact on the county operations or on any of the staff here at all. In fact, most of the time you wouldn't even know there was anybody there.
And that's what we find. Our clients want services. That's why they're coming for help. So I think having this opportunity for this program will just increase the amount of people that are getting help, rather than maybe that are in some of the areas around town where they're not getting support. So that's our goal. Next slide. Just letting you know some of the work that we've done. We had a conference day just last week, and it was really exciting and interesting. And it was for our staff, just to make sure everybody was on board and excited about the program. And I just wanted to share a little bit about what we had done. We had some representatives from Saugeen First Nations, and we had also some Dr. Marky Twist, who spoke to us about gender inclusive treatment, because as you may recall, we have some designated Indigenous beds and some designated transgender beds. So we just wanted to make sure our staff are really culturally sensitive to these groups. And so we had some really good training on this, and we will continue to do some more of that, and as well for the community. And next slide. So I wanted to share a little bit about the work being done. And as you can imagine, a lot of working groups. I mentioned briefly the treatment, but we're moving to a 1 week medical detox model, and then about a 3 week treatment model, and then the longer stage up to 6 month ongoing intensive treatment model, where people would move into those units. So we're of course doing a lot of work groups around what is the medical detox, what is the medication pieces. We're looking at, working with pharmacy, wait list, should we get to a point with wait list management. We're looking at admission, transfers, and discharge criterias. And then we're making our plan for external stakeholders, which we've started to meet with. And then, of course, the ongoing construction and the groups that we're offering. So the really hands-on, what are we offering in this program? Our goal is that when a patient comes in the door, that unlike other treatment programs, they have a biopsychosocial kind of workup done, and it's determined on an individual basis what a person needs. Maybe they need individual trauma counseling. Maybe they need some distress tolerance skills. Maybe they have some medical needs. Maybe they need RAM medication. So it's going to be a very individual program, and appreciating that not all people may want to move into the 17 bed units, because they may have slightly different goals than we have for the building. So in that vein, we've met with our peer group from the drug strategy, which was really an enlightening and a great group where we met to discuss. We had very early on discussions with the development services sector, which included community living, and we need to re-engage with them now that we have a building. CMHA, of course, the drug strategy, the legal clinic, ODSP. We talked about wanting to have people not have to leave the building for service. So does that mean OW can come 1 day a week and do a clinic out of there, or ODSP comes? So those are some of the things we're working at. Also having SOHAC come and different faith groups and our First Nation communities to work out of this space. And we certainly invite police and EMS services to be engaged in the building too, in a positive way. When I say that, EMS, I think, has that very easily positive relationship with the community, and sometimes police do with our population, and sometimes they don't. But we know there's really great opportunities to work on that relationship as well with our clients. And so we're also looking at, we've started to procure our furniture and equipment, and that's a job in itself, but we've got some lists and our staff have gone through it and we're starting to start that work. And then the transitional planning from our addiction withdrawal management into this new one. And again, targeting that will be open fall 2023. Next slide. So we did prepare a recruitment video, and I had thought I might show it today, but it just needed a few little edits. So that is going to be one of the, as we all know, staffing is critical to run a good quality program. So we know that people are interested in the new, the cutting edge, and so we're hopeful that if we spread the word, and we would invite you to spread this video as well, that we will get some really good candidates to help us further the work. We have done some of the staffing already because we have increased our current withdrawal management from 9 beds to 21. So we've hired some of the staff, but we need to hire the rest of the staff as well. So that's my quick update. So I'll take any questions.
We're looking for hands. I have a comment, Naomi. I just wanted to say that the removal of the stairs going up to that building is, to me, a no-brainer. I think that's a great idea. It's really the only access to the property, especially if you're putting up fencing. So I think that was a great move.
Yeah, thanks. And Shirley? Oh, sorry, I'm not to lead this part, am I?
No, that's okay. I'm looking. Shirley, go ahead.
Thank you so much, Brian, and thanks, Naomi, for your presentation. And just one question. I'm wondering if you'll also be prepared to deal with eating orders in this facility.
Yeah, often eating disorders does fall under addictions. And I don't imagine that we will. I do think it needs another level of specialization. Having said that, we did meet with, as I mentioned, our drug strategy, our peer advisory group, and then at the conference we had one of the things we had is a panel discussion with an ethicist and different members, and we talked about what about we have patients that are addicted to benzodiazepines and they're typically not allowed into treatment programs. So prescription kind of addictions. And yet we know how hard that is to detox off of benzodiazepines. And so as an example, that one we were really struggling with, because generally the norm is that you don't admit them to these kind of programs. But we felt like it was, the hospitals can't do it. They're overwhelmed, and it's really hard. It's really just the smallest changes in your so a benzodiazepine would be Ativan, Valium, those kind of medications. They are, you can increase your dose over time and be on such a high dose, and it's so hard to come down on. So we've decided we will provide service to that group. And we've also been really struggling with the age, because we know that we have a lot of homeless 15, 16, 17-year-olds. So to say it's only for 18-year-old and yet they're homeless. So we're really working through that piece as well. How do we provide that service and provide, safety for the younger group as well? But having said that, to circle back to eating disorders, our counseling group is working with Eating Disorders Ontario around an education plan, and really working at making sure we can find more resources for eating disorders. But I don't think this space is going to have that expertise unless they are already they have another addiction, and then we would then refer to our existing eating disorders counselors, which are very few, but we would certainly prioritize them if they have another addiction as well.
Follow up, Shirley, or are you good?
No, I'm good, Cheryl. Brian, thank you.
Okay, Councillor Compass.
Thank you, Mr. Chair, and thank you, Naomi, again for for all of the work that has gone into this particular project. Two things. I just wondered if it would be possible for us to have a look at your recruitment video. I think that might bring a perspective to all of us in terms of actually what you're advertising for staff and that sort of thing. And the second piece was to follow up on our earlier conversation. I know that there's a special program that is being included in the mental health program here, and I wondered if you'd expand on the occupational stress injury piece.
Sure, and I can't share the video. There is a significant error, and if it was just you, I would share it. But because it's being videotaped, then the error, perpetuates itself.
Compounds.
But I think the error will be fixed within the week. And can I just send it to Sarah to send to everyone on this committee?
Yes.
Okay.
That would be great. Thank
I'll
you.
do that. And then as for the OSI clinic, we did not get full funding for the operational stress injury clinic. So we no funding, to be honest. So we've been really working on how do we do this. So Mayor Klumpus and myself and a few other people, we met with St. Joe's, who does run the more official OSI clinic out of London, Toronto, Hamilton. So they have agreed, and I will say this is a big thank you to Mayor Klumpus, who has been very, very persistent in getting this service. And we so appreciate that, because that is what is needed in funding for mental health and addictions. So St. Joe's is willing to come and have a clinic. So they have confirmed they will be coming and doing a clinic, but unfortunately they can only do those RCMP and military. They have very strict rules that they have to follow. But our thoughts had been that if we get them here and they're doing this work, they have agreed in theory that we could tag on to their expertise. So they will have their experts in this field. And then in time, we can move somebody from our counseling into that program and kind of tag on to the work they're doing. So they would be side-by-side programs in the same space. So the first step is to confirm how and when they're moving over. And then the next step would be, how do we support that? The next stage, which would be then for EMS, our police, and the like. So that's where that program's at.
You good, Barb?
Just to a quick addendum, if I may, Mr. Chair, and
Sure.
that the location of that particular program will be in the Meaford Hospital. Is that still on track?
Yeah, it is.
Great
Yeah.
news. Thank you.
Good. Thanks, Barb. Selwyn?
On mute there. Thank you, Mr. Chair. And Naomi, thank you for the presentation. Very good and exciting to see this all coming together. You mentioned that there are beds designated for two groups, being Indigenous and transgender. I wonder if you might tell us what went into the decision around the designation, the designated beds, and specifically whether funding had any influence on that. Whether
Yeah.
there's a specific pot available for that.
Yeah, certainly with the funding, usually with the ministry that we deal with in any case, there usually is some very specific targets. And they did put the targets in place for the Indigenous and transgender, and it's usually in order to, ensure equity in our system. So I don't see it as those two beds are this and that bed is that. I think the reality is we want to do good service to both those populations, and it's just a way to ensure that that happens. And like I said, I can assure you it would happen in any case. We would make sure, and we need to continue working with our Indigenous groups on what does our healing space look like, what does our signage look like. One of my earlier conversations with staff from SOHAC is how much they appreciate the Grey County signage that's in the county building there, and so I was actually going to tag you later, Kim, around who is the designer, who is the person that did that work, because it was flagged as exceptional. So we would do.
Kudos to Anne Marie for that.
Oh, thank you, Anne Marie. To share how that went, because it was, like I say, our community has really appreciated that, and so we want to make sure we equally make those considerations.
Okay, any other comments, questions? Naomi, I just want to ask about the construction. Is there any barriers like it's so hard. You talked about furniture and stuff, but is there anything that you foresee that could be holding up the construction or the progress in all of this, or is everything kind of coming together really well?
Strangely enough, I have to say, so far it is coming together well. I mean, I think they were a little surprised at, I'm not the construction person to label the parts right, but in the electrical panel there, the switches, the fuse boxes, I understand were cleared out and probably sold, and some other damage had taken place, but the team has been really resourceful, and I do believe if there's not electricity in there shortly, because they've been using a generator. So that was a priority, and I do think it was scheduled to be on electric very shortly, if not already, so that the sound of the generator didn't disturb the neighbors. We moved it from one side to the other side of the building. So I think we won't know until it happens, but so far the developer has been very forward thinking, and certainly they had some lead time before that we, as you all know, we wanted to run with this project, but we had some holdups. So I think they have a lot of the things in the queue.
Great, thank you.
Mr.
Allison?
Chair? Oh, my apologies. I just wanted to make sure that Allison's hand was seen.
Yeah, go ahead, Allison.
Just really quickly around the neighborhood safety, I did just want to bring to everyone's attention that when I was writing the letter of support for the treatment center on behalf of the drug strategy way back, I did come across some empirical evidence that talks about the false sense that people have around crime and safety, that may become an issue once a treatment center is put in place. But then this empirical evidence, it shows that there's actually no difference between having a treatment center or a convenience store located in a neighborhood in terms of crime. I don't know if that may or may not come in handy in conversations with neighborhoods, just to help put them at ease as they anticipate the opening. But I just wanted to make people aware that some of that research is out there, and I'm happy to share it.
Oh, thank you, Allison.
I wouldn't mind seeing that, Allison, if you wanted to just provide a link. That would, thank you.
I think in discussions with some of the neighbors, and we had a lot of calls, that was one of the things. There's a stigma, obviously, that needs to be reduced, and I think that comes with education. So I was glad to hear you say that there's progress in your community engagement, and I think that'll make a big difference too. Once people understand what this is and what it involves, I think it helps a lot.
Yeah.
Okay, so I don't think I see any other questions. So thanks very much, Naomi. That was a great presentation, and thanks very much for everything you do. Appreciate it.
Thank you. Thanks for allowing me to present.
Okay, we'll move on to item number 4, CAO Windgrove. Actually, there's a recommendation here, so let's get that on the floor. Can I have a mover and a seconder for the recommendation? Councillor Hutchison and Barb Klumpus. Okay, Kim, you have the floor.
Thanks so much, Mr. Chair. And Sarah, if you will put the slides up. Good afternoon, everyone. And it's my pleasure to provide an update on the status of the final report for this task force. And the next slide. In preparation for this meeting, a draft was shared with everyone. And the sections of the report as it's been drafted include an acknowledgement of the contributors who made all of this work possible. And I did want to note a couple of changes there. Sandra Winters, I tried to adopt her from the Peer Advisory Committee, but she doesn't belong to Grey County. She belongs to the Peer Advisory Committee. So that correction was made. And somehow Alison Govier wasn't missed properly being acknowledged as a contributor. So that has also been corrected. The executive summary section was shared in a report that came before this task force on August the 9th. Since that time, in reflecting on some comments that were provided, it now includes text that says, peer advisory committee members bravely spoke of times of empowerment and disempowerment while navigating services within the community. Those with lived experience should be included in program development, implementation, and evaluation discussions. So similar to the way that other presentations and recommendations were included in that executive summary. Not only does it mention that the peer advisory committee presented, but talks a little bit about the recommendation associated with that. And I appreciated those comments. As well, the report includes a brief summary of all of the presentations that came before the committee, just for ease of reference. And then a section that's near and longer term recommendations, both those of the Hanover Owen Sound Task Force and the Drug and Alcohol Task Force, as well as some that are specific to Grey County and others that are specific to service providers and the province. There are, as we go through this afternoon, I'll try to note some of the changes that have been brought to my attention or recommendations. Certainly some of this work is very much a moving target, and it's actually really exciting to see the progress that's happening along the way, even in the short time since these things were drafted. So it's a very hopeful report, I think you find. So if we go on from there to the next slide. Overall, the findings of the report are that there is a committed group of organizations and health professionals who are actively engaged in addressing mental health and addictions challenges faced by both individuals and communities. The prevalence and complexity of mental health issues and substance use, unfortunately, though, is growing. And the lack of treatment and housing options leaves people publicly struggling, which breeds fear and stigma in the community, as we just discussed. Our member municipalities are challenged to respond to the crises of homelessness, food insecurity, and property crime in their communities. And they look to the county and they look to the service providers for guidance, for information, for solutions. Next slide, Sarah. Both external service organizations and county housing, social services, and paramedic services are being really stretched and feel underfunded provincially to meet the demands that are being placed upon them. Mental health and addictions and community support providers are challenged by siloed and restricted funding, needs that exceed the funds available, dependence on fundraising to meet needs in some cases, and a shortage of health human resources, especially those with specific mental health training, as Naomi just mentioned, and a lack of centralized case management, a centralized case management system that's accessible to all providers. And I do know that that's something that's being actively looked at. There needs to be more focus on upstream interventions and prevention. So while there's a lot of work that's been invested in to try and deal with the situations that are presenting before us, the upstream and prevention side of things may be a place that the county and others want to look at more actively in the future. Moving on from there. Okay. So the overall recommendations are that improved outcomes for individuals and communities will come from taking a holistic approach, looking at individuals, the families, and community, and include the perspectives of those with lived experience. People need basic income, stable housing, food, and access to healthcare for counseling or other treatments to succeed. Early intervention is key to successful treatment, and supporting youth and families is critical to reducing the cycle of intergenerational trauma. And from there, so overall, we looked at the recommendations and we kind of divided them up into themes, but I think they're so interconnected and intertwined. It's really, it will take a look at all of these things together to really, I think, start to make a change and difference in the system and the outcomes. But as we've spoken of before, the themes, data and analysis to support planning and reporting and advocacy efforts, There's community level recommendations, mental health services, support for youth and families, addiction services, and housing. Okay. We go specifically to the next slide on data and analysis. The health unit, and I would really appreciate it of the comments that were provided both at the presentation, but also later on by Dr. Zed and Dr. Era. The health unit, population health and harm reduction units, really does collect a good amount of data on incidents and conditions. They're well connected into other tables, planning tables, provincial tables, and with other service providers. So as a place to start with the data and analysis discussion, I think I would say that the recommendation that we work very closely with the health unit. It will provide a foundation for discussion at OHT tables, and I think going forward at the Community Services Committee. So I don't know, Dr. Era, I'm putting you on the spot, but did you want to add anything to that? Yeah, okay. Well, certainly
Thank you, Kim.
Okay, go ahead.
I echo everything you said. Thank you so much.
Okay, excellent. All right. So yes, data analysis is critical, and there are always opportunities for us to improve the collection, dissemination, and analysis of what's happening in our communities. If I go on to the next theme, which is around community development, and first and foremost there, creating the Community Services Committee at Grey County to continue to enhance understanding and develop local responses and solutions. Was felt that what we are lacking right now is a common place for different stakeholders, different other organizations and tables to really come together as kind of a common place, a single place where some of these discussions can happen, that our elected officials who can play a stronger advocacy role. If they have more information, the Community Services Committee would be a place to have those discussions. We did add a recommendation under community development to develop a framework to support the meaningful engagement of people with lived experience in committees and initiatives. And then that recommendation would be led by the Community Drug Strategy and the Poverty Task Force. Again, as I noted earlier, the health unit has a community leadership role in understanding and responding to complex situations and bringing resources to address opioid and overdose related harms. So they do have a strong place to play in some of the issues that are being faced at a community level. Moving on from there, Sarah. Mental health services, and thank you so much, Naomi, and your team for the additional comments that you provided. One recommendation is the efforts being undertaken by Grey County to obtain base funding to maintain the SOS program, the street outreach program, beyond March of 2023. There is also perhaps an opportunity to seek additional health, human resources, and funding under the substance, psychosis, autism, and other mental health services. We talked about the OSI clinic that's being developed by GBHS with St. Joe's in Meaford, which is great news. CMHA and GBHS are now able to see clients without a formal diagnosis, and I think that was something that was flagged in the presentations, and so it's great to know that that's being looked at. And the health unit did note that they are actively engaged in mental health programming and alcohol and drug strategy surveillance. So that those changes are being made to the report. The section on support for youth and families recommends that there's support provided to implement additional pediatric mental health beds at GBHS. And certainly that would be a provincial responsibility to provide those funds. Earlier in our presentations, we heard from Keystone and the outgoing ED Phil, who talked about their desire to expand the live-in intensive treatment facility for youth. I think we can all appreciate that the world of construction and development has been a quickly changing one. So in discussions with the new executive director, David, we anticipate that request will come forward from the Keystone organization. It's just somewhat delayed while they kind of regroup around some of the changes that they've seen. So when it's appropriate, we will see that from Keystone, and then as Grey County, we can work with them and bring that forward for council's consideration. The other recommendation here came from our school board presentations about additional resources and staffing within the school system that would come through School Mental Health Ontario. And so the school boards themselves would take a lead on that. And then finally, there was recognized a need for improved access to family counseling resources. And I have both CMHA and GBHS noted as potential organizations to take a lead on that sort of advocacy and resourcing. But Naomi, can I ask you, would that be correct from your perspective, or is that more CMHA?
Yeah, it's interesting because in the 90s, when I was a frontline staff, we did a lot of family counseling, and then the Graham report came along, and then it cut that all and moved it into just direct service with seriously mentally ill. And so that we know is a big gap. We have tried to fill it a bit with family support workers, which we have here at GBHS, and CMHA has as well. And we've also acknowledged in this, the new model for Bayview, that that's a really important part of our plan. So it's again, part of that assessment. Is there a family? Can we involve them in the treatment? Is the patient willing to bring them? So we have really moved in that direction. So, but is there need for more family counseling? Absolutely.
Thank you very much. Okay. Moving on from there to the theme of addiction services, harm reduction was mentioned in several of the presentations that came to the committee. Certainly GBHS plays a role there, the health unit plays a role there, and the community drug and alcohol strategy plays a role there. Making harm reduction training widely available to help people to better understand what's required, what the benefits are. GBHS, the health unit, both play a role there, again, with the community and drug and alcohol strategy. There was a recommendation to advocate for safer supply initiatives, and Allison's here from community drug strategy and the health unit. And then as part of the presentation around SOS, and you think about SOS as providing an immediate or short-term support for people. The question then is, what happens to those folks in the longer term treatment services, which are beyond the scope of the SOS program. So making that connection through to whether it's residential treatment programs or ongoing counseling and support, Grey County, GBHS, CMHA working together to identify what those opportunities are and the appropriate processes to ensure that people get connected and get the help that they need on an ongoing basis. Housing was another theme, and housing with supports is something we talked a lot about. While the market or the availability of housing of any kind is very, very limited at this time. Housing for people who need support, who need a worker with them, is even more critically a more critical shortage. And so normally that is the responsibility of CMHA through the Ministry of Health to seek those resources. You'll all be aware that the county through the 14th Street project is making a capital investment in at least providing the space for additional supportive housing. However, the staffing of that facility is outside of the county's area of responsibility. And so we'll be working with CMHA and anyone else that we can find to make sure that we have the right people in place to keep the residents of that facility safe. Other recommendations, additional emergency shelter spaces. Again, since the committee heard the original presentation on emergency shelter, the county has brought that program in-house, and we're actively working across a whole variety of services and service providers and private motel operators, et cetera, to try and do what we can to obtain and maintain additional shelter spaces. But it is a huge challenge because the demand has grown far beyond anything that we've seen in the past. Final note here, the health unit again as a place to turn to as far as additional data analysis and to enhance our understanding. The health unit is planning to undertake consultation and is able to provide expertise and data on the impacts of insecure housing and homelessness on both children and adults. So that may help to inform some of our future deliberations as we think about prevention as an important aspect of this work. So that kind of wraps up the current status of the report. So I have some more changes that I want to make, and certainly if anybody has any comments or suggestions today or in the future, please do provide those. We're so grateful. I do see that this work will be a continuing kind of work in progress because it's always changing, hopefully for the better. But we will get the report finalized and we'll get it desktop published properly, and we'll make sure that everyone has a link to that. And then on Thursday, County Council will be asked to consider the implementation of a community services committee as a recommendation to the incoming council. So we hope that can happen, that we can continue to work with our partners to build understanding and create solutions. I think all of us are going to have to prepare for a winter housing crisis, and anything that we can do to help people, whether that's helping our member municipalities to put together plans for warming centers and that sort of thing, or and more substantial shelter options. We're going to need to do everything that we can on that front. And so with that, I would ask if there's anything else that people would like to have considered, and I would welcome any questions. Thanks, Mr. Chair.
Okay, thanks, Kim, for that presentation. Kim, I also want to thank you for taking the lead on this entire task force. It's a great presentation today, but it's only a part of what you've done right from the start. I also want to thank all of staff too. I know that these task force, when we strike a task force, that just adds to the already busy workload that all of our staff members have to deal with. And so we really appreciate that. There's no way I could name all the stakeholders in this, but thanks to all the stakeholders who had input, great presentations. It was just an educational experience for me, and I'm sure everyone else. It was certainly a summer of learning, and I really appreciate that. And I know, Kim, from our previous conversations, all the stakeholders had input right up to the recommendation part of this too, and I think that just speaks to a collaborative effort by everyone, and I'm certainly glad to see that there's going to be a community services committee. I think that's going to make all of this continue on and have more people talking about it. So kudos to everyone who are involved. Okay, with that, questions or comments?
Shirley?
Can't see anyone.
Thanks very much, Kim and Chair O'Brien, and I certainly echo all of your comments, Brian, with appreciation for everyone who's participated in this. And just a thought, and I know it would be more conversation for tomorrow, Kim, but thinking of the work of the Affordable Housing Task Force and recognizing how often we've heard housing mentioned with this committee. And I know it will also be a part of the Community Services Committee, but I'm just wondering if there might be consideration given to continuing with that Affordable Housing Task Force focused on the needs that we've heard throughout the discussions through this particular committee, and just a thought that I didn't want to lose that perhaps we can address tomorrow, but just wanted to share that with the committee today, that I see a strong opportunity for that particular committee to be really focused on the issues that have come out of this work that perhaps could be an advantage to the community services.
Thank you, Shirley. And certainly, you know, the legislation that was tabled yesterday was it's extensive and has the potential to be a game changer in some ways. So we're, as staff, we're still trying to digest what the implications of all of that are. So, I mean, I think there's a place for really good conversation about whether or not it's appropriate at this time to continue on with affordable housing as a standalone committee versus weaving it into community services. So I would look forward to that. Thank you.
Thanks, Kim. Any other questions or comments? Selwyn, go ahead.
Thank you, Mr. Chair, and I too echo all of your comments of thanks to everyone. This is just terrific, and I know it is not an easy task to pull together the amount of information that we heard and to bring it down into recommendations. So this is very, very good. The report acknowledges that that our clients come with complicated needs, that their needs are quite complicated. But it strikes me that the social services web is equally complicated and difficult to understand, even for people who work within it. And so with that in mind, I wonder if the report sufficiently acknowledges the need for, under, I think, data analysis, it talks about mapping of services. I know Anne-Marie, our social services workers, their role is being transformed. Where I'm heading is in talking about the need for navigators or Sherpas, I suppose. And I just wonder if the report adequately talks about, I think it's in there. If you look for it, it's talking about the need to map it and to, understand it better, but I just wonder if we couldn't strengthen that whole concept of having social service navigators or Sherpas, because the system is complicated along with clients who are complicated.
Yes. If I may, one of the recommendations for the county in the report has to do with kind of putting together of a master plan. And I think that idea of this, kind of community services master planning framework might also bring to light exactly what you're speaking of, is that, where are those handoffs happening? Where are they working well? Where is there, where are people really facing a lot of challenges moving through parts of the system? And so I don't know, Anne-Marie, your caseworkers I know are very good, but as the warden says, their role is changing and evolving with the social services modernization. I don't know, any initial thoughts there?
Yeah, certainly. I mean, that is stability worker is what they're sort of moving towards that model. So it's looking at a holistic approach. So a holistic rather than we were that benefit worker that checked those boxes to make sure that, you know, they had everything they needed for financial assistance. So I think with that role changing, there'll be an opportunity for those that are on assistance, like Ontario Works, but you know, it's probably a model that could be broadened out to a more community service oriented. By name list is the same sort of idea. It's that caseworker approach. So there's probably, as we move further along in both of those journeys, to switch over to those and get more advanced in our thinking of that holistic approach, that it could be a community-wide initiative too. I think, and again, one of the concerns, and we've talked about this a million times, is it's access to the services, but sometimes those services are waitless. And so that's why probably the system doesn't seem like it moves the way it should. But the first thing is connecting, at least getting them on that wait list, or getting people aware of them. So certainly there's lots of development work that could be done. And I agree with you, Kim, if we're looking at a master plan, if we look at it in that holistic approach and that case management approach, we probably could look towards doing something that was community-based too there.
Thanks.
Yeah, go ahead, Sol.
Thank you. So help me to understand, is there some central place and whose role is it? Is it the health unit? Is it county social services? But who is it that takes the client and says, okay, you've got a multitude of needs. You've got housing, emergency housing needs. You've got an addiction problem. You've got some mental health needs. You may have some health issues, dental. But who is it that helps that person to figure out where to go and when, and you know, is there a navigator, or is that just happening sort of organically? They go here for this and there for that. Is that happening right now?
I think it's because everyone has such different complex needs, right? So there's what's called no wrong door, right?
Right.
So every community service should be aware of what other community services offer. So wherever that person presents, whether it's at the hospital, whether it's at CMHA, whether it's at our OW office, they should be able to say to them, oh, you need housing, here's a resource. Oh, you need this, here's a resource. And that's the ultimate goal, right? So if we can ensure that there is some sort of, you know, even whether it's a staff level getting together and talking about those services, it does happen on a housing and homelessness group that we have different agencies that get together and can share what services are going on, look at gaps, and can bring specific cases there. So that is happening, and that has actually expanded to include more and more. I know the hospital's there, CMHA is there, like a lot of different services are there. So it is happening. But it's probably just not as formalized maybe or talked about as much as it should be. So that's something that we could look at. But no wrong door is very important, so that wherever somebody presents themselves, they're all getting the same information.
Right. And so, Mr. Chairman, final comment. I guess if there's no wrong door, then that recommendation under the data analysis section about mapping of services will really help everybody to understand what exists where, which will help that navigation, right?
Very much so.
Thank you.
Okay, Allison Govier.
Yes, I just wanted to add to Selwyn's comment there that, like, back right before the pandemic, the drug strategy held a full day workshop, and it was all about, and over 40 service providers came from our area to learn about how to incorporate peer positions into their agencies. And that navigator position came up a lot during that workshop. And there was definitely an appetite and a willingness from all of the agencies to start to look at this model of peer work and how to integrate it. And then I think some have moved along with that, but there was appetite for a community of practice to come together and really look at, like, what are the gaps, where's the capacity needed, what are some of the challenges that we're facing, in order to incorporate those peer navigator positions at every point of entry in the system. Like you were mentioning, you know, where do you go first? Who's responsible for this? That it really needs to be integrated into each part of the system. And I have heard of like physicians, for example, will say, oh, it's such a relief to me to work as part of this multidisciplinary team where we have a peer navigator, because it frees up hours of my time a week where I would have been calling here and there and, you know, trying to do some of this back end work on behalf of the patient. You know, it would be such a help to me if we had more of these resources in the community. So I just really echo what you're saying, and I hope that we can bring that back into the discussion when we do the mapping.
Okay, thanks for that. Any other questions, comments? Okay, seeing none, we have a motion on the floor, moved by Councillor Hutchison, second by Councillor Compass. Call the question, all in favor? And that is carried. Item number 5, is there any correspondence? None. Number 6, other business, any other business? Seeing none, next meeting to be determined. Number 8, we need a mover and a groover for adjournment. Councillor Carlton and Warden Hicks, all in favor? And that's carried. Thanks very much. Thanks to all.
Thanks, everyone.
Thank you all so much. It's been wonderful. So grateful to all of you. Thank you.
Good work.
Bye.
Bye.